this some last year, right? We talked about you a little bit. Oh yeah, we did peanut butter and jelly. This one goes a little bit more in depth. And this becomes, your verbal communication skills become important because you guys are actually interacting with patients and you want to, make sure that you communicate effectively. So what are some things we talked about, we said that you need to be sure and not do last year? Do y'all remember any?
Don't be too bossy.
Teacher distinguished, please bar this announcement. We need these 7th graders to report to the top part of the cafeteria this time. 7th graders.
Yeah, we want to make sure that we aren't actually telling patients what to do, but that we're giving them their options, that we're, encouraging them to make the best decision. We give them all the information they need to make a good decision, but we can't actually make decisions for them. What else do you remember?
Be open-minded to other people's suggestions.
Okay, be open-minded. So make sure that you respect their beliefs, their opinion, their morals and values.
Not everybody does it the same.
Yeah, not everybody does everything the same. So make sure you clarify, right, that they understand. Ask them questions. Make sure that they understand. Good. We'll talk about all of those in a few more today. So verbal communication. Of course, verbal means we're using words. So it can be written. It doesn't necessarily have to be spoken, but written words or spoken. So some different areas in healthcare, okay, specifically with the patient or their family, are areas where we definitely want to make sure we communicate effectively. Giving reports to other healthcare professionals. What is our language going to look like with healthcare professionals versus patients? Okay, we're going to use our medical terminology, right? Our abbreviations, terminology that we've learned. I'm not going to say, oh, over on their bottom end of their right arm, they cut themselves. I don't know, whatever. We're going to say on their right upper extremity, distal part of their right upper extremity. You're going to use different language, but I wouldn't want to say your distal right upper extremity if I was talking about, talking to a patient. They're not going to know what I'm talking about. Yeah. And then documentation. So we'll look at documentation in the next few weeks. And towards the end of the semester, we'll really look at that too. You guys, whenever you start doing your case study, we'll go through a patient's chart while you're at Birchwood, and you'll really get to see some documentation. We'll look at some of the physicians' writing, their documentation, and you'll see how all of those abbreviations and the terms that we've learned really, really work inside their charts. Okay, elements of effective communication. First of all, it must be clear. And this becomes an issue, especially you'll notice when you do home health or you work at, you go and do your rotation at Birchwood or maybe even at the pharmacy if you saw any patient interaction. You're going to have people who don't understand what you're saying. Maybe they can't hear you. Maybe they're just not, they just don't have, they just can't think enough to really make it make sense. So first of all, use terms that they can understand. Like I said, I'm not going to say distal right upper extremity. I'm going to say, hey, on your right arm, you need to, whatever. Want to use words that they understand. How does that make you feel if you go in somewhere and people are using words that you don't understand?
Stupid.
Makes you feel stupid, right?
That makes me mad.
Makes you angry.
On purpose. Yeah, irritating.
Does it make you want to listen to them?
No.
No, you don't trust them because they're not speaking to you in terms that you understand. If you don't know what they're saying, you're not going to trust them, and you don't want to talk to them anymore. You don't want to listen to what they have to say. It makes you feel stupid, like you said. Same thing goes for when you're talking to them. It says, know the developmental level of the patient you're caring for and use language appropriate to that level. What does that mean?
Don't use big words for somebody who's at a certain, like if a person's very mentally ill up here, you're going to use like, not baby words, but not really high school words.
Yeah, you need to look and see, how much can they understand? What is their age level? What's happened to them? Maybe they've had a stroke or maybe they have Alzheimer's and so they can't think the same way that you do. Okay, am I gonna approach, if I'm starting an IV on a person, how am I gonna approach that differently for a 5-year-old than I would an adult, do you think?
You'd hide the needle from the kid.
Okay, at least in the beginning, right?
Mm-hmm.
Not gonna wanna pull it out and say, this is what I'm gonna stick in your arm, right?
You're gonna want to give them candy or something.
Okay.
You distract them.
Distract him, good.
Yeah, like you gotta distract me.
Yeah.
Make the shot.
Exactly, right? So, yeah, maybe you need to offer him some kind of prize at the end. Now, am I gonna go to adult and say, okay, when we get this IV in, I'm gonna give you some candy?
No.
What's that gonna make him feel like?
As a kid.
Are you serious?
Yeah.
I'm teaching me.
Okay.
Exactly.
candy is.
Okay, they're not gonna like you because they're gonna think you're.
I would like you.
Yeah.
I like
will.
candy.
You're gonna give me some
If you're
candy.
gonna give me a basket full of candy, I like you.
Well, okay, we'll say an actual
Okay,
adult.
I'm a little kid when it comes to going to the doctor and getting shots,
Mhm.
cause I don't do shots, as you can tell.
But when you're 25 years old, hopefully you still won't be that way. You might be.
I hope not. I don't know.
But like it says, here's the example. You might be able to ask an adult to urinate in order to collect a urine specimen, but a child might not understand the word urinate. You might have to say TT or whatever, I don't know. Deliver the message in a clear and concise manner, so good grammar, correct punctuation, okay? I don't wanna document in the patient's chart, your grammar is gonna be horrible anyway, cause the way that you document, you leave out any like extra words. Like instead of saying, today the patient presents with blah, 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 blah. It's like, patient, PT, HX, DM, diabetes, patient, history, diabetes mellitus. Instead of saying, today the patient presents with a history of whatever. Your grammar's gonna be horrible, but you need to still have an idea of, it needs to make sense still, so.
Don't put it out of order.
Avoid slang terms or, words with double meanings. What are some examples of those? What are some everyday words that we use?
I keep thinking
Shoot
of
has a
tomato
double
and tomato.
meaning.
What'd you say?
When you say double words, I keep thinking of tomato and tomato.
Oh, no. I like,
I can't think
Like-
of any right now.
And then the D word, you have the bad word, and then you have like the little big
well, I'm
wall.
thinking more like, saying things like, that's cool, okay? Like, could mean
Yeah.
that's awesome, or it's
Or,
literally is cold, or that's bad.
Yeah,
It could be bad or good. You know what I mean? So don't use slang terms like that. People are not gonna, especially,
Older people.
some people are just not gonna understand, especially using something like bad, okay? That could go either way. So avoid those kind of terms, slang terms that you use, okay? LOL, some people don't know what that means. Don't use acronyms, okay? Remember DVD. Don't be dumb.
Oh.
I didn't know that.
That's my own. That's the one I put when people write IDK on their paper. I write DBD.
Wait, did you say Amber before you said that?
No.
I thought you said Amber.
I thought you did too.
I
I
was
was
like,
what?
Or meaningless phrases such as or all that stuff. Be specific when you're talking to people, okay? They don't, it's, like I just did. That was
So you can't
very good
use the
example.
word dang.
The tone and pitch of your voice are very important, right? If I come in here in the mornings and I'm like, okay, get out your books,
I'm not gonna
versus, okay, get out your books. Okay, there's a huge difference in that. And so people can tell if you're angry and you don't want to be there. They know. Just like you would know. Okay, you've all had nurses or doctors or whatever who you feel like,
They do that all
Okay.
the time.
who you feel like you go in and you're like, oh, they don't want me to be here, and you want to hurry things up because you're just ready to leave. Don't speak too fast or too slow. Okay, if someone can't hear me, it doesn't mean that they're stupid. Okay, then you need to talk really slow for them. Just because you need to talk loud, just talk at your normal speed. Just talk louder. Okay, just because someone can't hear doesn't mean they don't understand.
Yeah, when I
I
was
feel
at
like
the
I should
clinic,
talk slower though, so they can
when I was at the clinic and she was talking to the dude that she was drawing blood from, and she just randomly started talking loud. I was like,
You'll learn, especially home health. Ooh, have to talk
Yeah,
really
and
loud.
when I went to, Mama asked me to break one of the residents here up there, and so when they came in, like she talks loud too, and when they came in there, they were just like yelling at her, and I was like, why are y'all talking so loud? It's not dumb.
Yeah, it's not about talking loud. It's about that, slow. Just you don't want to make them feel dumb. I'm not telling you to talk at your normal speed, but it's not like you have to say, "Hi there." Okay, they can.
That would get on my nerves.
Yes,
Yeah.
it would get on mine too. And then in written communication, make sure you spell everything correctly, correct grammar, like we talked about. Okay, the receiver must be able to hear and receive the message. Okay, if you have patients who are medicated, patients who have difficulty understanding because of some kind of brain injury or some other kind of psychological disease, Alzheimer's, for example, like several of the patients at the nursing home have, keep those things in mind. Hearing loss, vision loss, those are all things that you need to think about when you're speaking to them. Use alternate ways to communicate, such as writing the message. I used to have a patient who had lost her hearing. I don't know, they never really figured out why. Sweet, sweet, sweet lady. But anyways, she would always have a marker board. And so she could read lips pretty well because she did hear for years and years, and then something happened to her hearing. I think it was a medication issue or something. She had toxic levels of medication that made her lose her hearing. But anyways, and so she always kept that marker board. If she couldn't read my lips, she would just write it on the marker board or whatever. So be willing to do that. Receiver must be able to understand, use terms that they understand, like we said already. Their attitudes and prejudices may interfere with understanding. Like it says, if they don't have confidence in the healthcare worker. And you'll find that, here's the deal, you're there for a job, okay? Some people are just not going to like you because of whatever reason that they choose to have. And that's just the nature of it all. Maybe you look too young, or maybe you look too old, or maybe you say something that makes them think that you don't know what you're doing. Okay, I've been there. That's happened to me a bazillion times. I always looked younger than I was, and I was 21 when I had my license. I was 21 when I got my license, so I was young, and and a lot of them didn't want me to take care of them because I did look so young. And I used to get really offended, but then that's just the nature of it. You just gotta say okay and move on. It's just the way it is. So don't take things personal. Just recognize that they may have their particular issues, whatever they are, and you just get over it and move
How'd you
on.
get your license at 21?
Well, I was young. I have a summer birthday,
Oh.
so I have a July
Me
birthday,
too.
and so I took my test at the beginning of June and got
Mhm.
my license a couple weeks later,
When's your birthday, Miss Bird?
July 1st.
Mine's about to know.
So, the healthcare worker's attitudes and prejudices may interfere with understanding too. And like it says, if the healthcare worker feels the patient's uncooperative, they may not respond correctly. And it's hard not to do that. Okay, like home health, if I go into a patient's home and they've gone in out of their medicine box and picked the pills that they wanted to take and left the ones that they didn't want to take, that's frustrating. It makes you not want to fix their pill box for them because they're not going to do it anyways. But you just got to get rid of your own ideas, get rid of your own opinions and judgments, and just do your job.
So if they don't,
Do you not have to make
if
them
they
take
just
the
pick
pills?
You can't make anybody do anything.
so if they just pick it out, you just leave it in there?
Well, if I come back and for the week that I've gone in and they've picked out some pills that they've taken and some that they haven't, I just send a note to the doctor and say, patient's not taking X pills or not taking this medication, blah, blah, blah. And, that's all you can do. You can't make them take it. Now, if something like home health, if they go a long period of time and they've been non-compliant, I remember what non-compliant means. They're not following, they're not cooperating, they're not following directions. They can be dismissed as a patient, but it takes a lot of documentation and a lot of time for it to get to that point.
What if they just always forget?
Forgetting is different than that. If it was really a forgetting issue, then you need to come up with some other way.
Yeah.
I've seen talking med boxes before. Some patients have had those there where they actually 8 o'clock, it'll sound like an alarm to come take the medicine.
But if it's like What do you mean if they forget?
Like if they forget to take their medicine.
Yeah, that's
Oh,
not
yeah.
really the
Like-
same as non-compliance. Non-compliance is like, they're just
I
not
thought you
taking it
meant
if they
like
don't
if
want to.
they just pick them out and they forget to take the other ones. I was like, what?
Interruptions or distractions must be avoided, okay? And most of my thoughts on this goes to home health, because the home is harder to have conversations with patients, because there are so many distractions. Maybe their TV is turned up too loud, or the mailman comes to the door, or some family member walks in, or the dog, pees on your bag. It's happened to you. Yeah, those things happen, so you have distractions, that come about.
What did you do? You were like, I can hear you now. Oh no.
I don't remember, it's been so long, but yeah. I'm sure I was like, oh, that's okay. It happens. All kinds of stuff happens. Trying to talk while answering the phone or writing a message will decrease the effectiveness of communication. And then environmental factors, like I said, TV, medications, whatever's going on that's causing that distraction. Okay, be conversation. So when exchanging communication, again, tone of your voice means a lot. You guys know that. You can tell by people around you what they really think according to their tone of their voice. What did we say? Do you remember? Was the message? How did I word this last year? How is most of your message communicated? Remember?
Your signals, your body language.
Gestures or body language, yes. Y'all remember that? And then your tone, and then your words, finally. So, that's what you think. Convey interest instead of boredom, okay? And this is important for you guys at clinicals. If you're like, okay, if you're doing that at clinicals.
Okay, I was looking around, but I was just trying to see what
I was
that
not
stuff
looking at the
was.
ceiling. I mean, if you're watching.
Oh no,
things,
I
that's
was
okay.
like trying to figure out what that stuff was because it's just a bunch of machines.
But
and I was just
you
like,
can tell people if you're interested or if you're bored, and patients can always tell. Be knowledgeable about the topic of conversation. Always be honest. We've talked about that before. If you don't know something, just tell them. Say, I don't know, but I'm willing. Let me go find that out. Always be willing to go find it out. Don't just let them not know, but do something. Okay? And don't be afraid to say that you don't know if you really don't. Now, we need to, I think that's why school is so important, that you're knowledgeable about the things that you should be knowledgeable about. But there's plenty of things, and you'll hear me, anatomy or in this class or whatever, may ask me something, and I'll be like, I honestly don't know the answer to that, I'll have to look it up. And there's nothing wrong with that. Somebody who can't admit that they, don't know something or that they've been wrong are the scariest people to be your healthcare workers, because when you're overconfident as a healthcare worker, people get injured because you think you know stuff that you don't, and you don't double check. So don't be afraid to say you don't know, but if you're finding that there's a lot of things that you don't know, you probably need to go study something, whatever it is. Be flexible. Like the bird, right? You may want to discuss a certain subject, patient wants to discuss something else. If you'll give them some time, a lot of times they'll answer your questions. So, and that's something in home health especially, I might ask them first about their family or something that really, got them kind of talking, and then I would go back to the questions that I needed answered. Now, I wouldn't spend an hour talking to them about that stuff, but I would kind of redirect it pretty quickly. But if you can get them interested in going, that builds a sense of trust, and so it makes them want to tell you when something's wrong or if they're concerned about something or whatever. Be clear and concise, stay on one subject at a time. That's one area I struggle with, for sure. Avoid words that might have different interpretations. Like we said earlier, be truthful, again. Rather be truthful and not know and tell them you don't know than to tell them something that's incorrect. Keep an open mind, and then take advantage of whatever opportunities you have. Okay, therapeutic communication skills. Therapeutic communication is kind of one of those buzzwords you hear, especially in nursing or any healthcare area, because therapeutic communication, therapeutic, you hear the word therapy in there, right? It's something that helps, it encourages. Really, really important that you understand the difference between therapeutic therapeutic communication, and non-therapeutic. So let's look at some of these. First thing is listening. Kind of like I said a while ago, ask them about their family, ask them about something they're interested in that lets them know that you're interested in them. Sit down, or whatever level they're on. If I'm in here talking to a patient and I'm looking down at you, does that make you comfortable? No, that's going to make you uncomfortable. So sit down. And I've been in some places, I've been in lots of different, I've been to Ethiopia and sat in little huts on dirt floor beside a cow, But sitting down with people makes them see you as a person and not just as a worker or someone who's just there to do their job.
Or someone that carries medicine.
Be alert and relaxed. Take your time. Maintain eye contact. Now that changes with different cultures. We talked about that a little bit last year too. But so kind of have an idea, but maintain eye contact. Some cultures, that it's not appropriate for a female to make eye contact with a male. And so those are things that you'll learn whenever you get to college and going through you'll have some classes where you kind of learn those kind of skills and different cultural values and things like that. But that's something to really pay attention to, is a lot of very male dominant cultures, it's not appropriate for a female to make eye contact. And then there's some cultures that nobody makes eye contact. Better to err, because we do live here, I would say better to err on the side of making eye contact than not doing that. Does that make sense?
No.
I would rather you make eye contact and be wrong than not make eye contact with anyone because you might be wrong. Does that make sense? Because regardless, anyway, indicate that you're paying attention to what they're saying. So what are some things you can do to let them know that you're paying attention?
Nod your head.
Nod your head, right? Say, oh yeah, really, I didn't know that. You give them some feedback. Silence, number 2, therapeutic communication skills. Just listening. It's okay. You're going to have quiet moments, and some people can't stand silences, but you need to learn to let them be. Sometimes that's just what people need. Take time to wait for them to initiate or continue speaking. You don't just have to fill up space. Allow them time to reflect on what's been said and to collect their thoughts. Offering yourself. How can I help? What can I do? Is there something I can do before I leave? That's one thing in home health I always said. Is there anything around here that you need me to do before I leave? Maybe they need me to change some clothes from the washer to the dryer, or they needed me to fix them. I fixed many a meal, doing home health or something like that. Is there anything, even in a patient's room at the hospital, is there anything I can do for you? Do you need something to drink before I leave?
Fluff your pillow.
Yeah. Shows caring and concern, and shows that you're willing and ready to help them. Reflection. Repeating what they've said. Does that let somebody know that you're listening?
Mm-hmm.
Yeah. If they say, well, that made me really sad, my son, blah, 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 whatever. And you say, oh, you said that made you really sad. Like, how are you doing with that now? Or repeat what they said. Reflect back on what they said. Validating, too, that that's what it meant. So you're, okay, well, you said that, you said that your son left. How does that make you feel? You go back, repeat what they've said to you, and kind of dig in more from there. Encouraging elaboration. Tell me how that felt. So encourage them to elaborate. Sometimes you'll get a lot of yes and no answers. Okay, well, yes, are you having pain today? Yes. Well, tell me what that feels like. Tell me when it started. Encourage them to elaborate. General leading statements, go on, or I see, like we said, that lets them know that you're listening. Giving information. The test results take 48 hours to return. Give them as specific information as you can. It's frustrating when you go in and they're like, oh yeah, we'll let you know. That's frustrating. But if they say, you should hear by the end of the week what these results were, that gives people an idea and something to look towards, and that's much more comforting to hear than just, oh yeah, you'll hear from us. You don't know what I'm talking about, right? So give them as much information as you can. Don't give them false information, but as much as you can. Open-ended questions. Tell me about your day instead of how was your day. How are they going to answer if you say, how was your day today?
Good
They'll say good.
or bad?
But if I say, tell me about your day, what are you going to do?
Explain.
Exactly. So open-ended questions, more than what they can just say yes or no to. Okay, non-therapeutic communication skills. I want to know if you really call these skills. But non-therapeutic, so these are things you can do that's going to deplete the communication that's going on. Don't use cliches. What's a cliche?
I don't know.
I thought it was something that you say over and over again.
Yeah. It's just a phrase or words that you use, everybody says them. I mean, if somebody random in the hall says, how are you? What are you going to say?
Good.
What if your dog got run over that morning? What are you going to say?
Bad.
Good.
You're still going to say good, probably. Not everybody. Some people will really.
If my dog got ran over, I'm gonna be sad.
But if somebody just random came up to you and said, how was your day? You're probably just going to say, fine.
I'd
Or
say
whatever.
okay.
So that's a cliche. Okay, it's not necessarily the truth, but you say it because you just say it. So some examples of these in healthcare. Okay, oh well, don't worry. Oh, you're gonna be fine. You don't really know that. You don't really know if people are gonna be fine every single time they ask that question. Oh, everything's gonna be okay. It may not be. So when you use cliches, that can give a false hope that they may not really have.
What if they need a false hope?
Yeah, but do you want to lie? I mean, here's the thing, you think, okay, so let's say family comes in and something's wrong with their child, and but the doctor hasn't really figured it out yet. They're gonna say, well, is he gonna be okay? And if you say yes, and then they die a week later,
You're gonna get sued.
That's kind of what happened with my grandma.
I don't know that you'll get sued per se, but you're giving them hope that's not really there. If it's me, I'd rather know that my child is gonna not be okay in a week, and know that. There probably are situations where false hope is easier than the other, but most situations I would say you'd rather err on the side of telling the truth.
When it came to my grandma, I would have rather know. There's a possibility that she was gonna die before it happened.
Yeah.
So you can prepare yourself for that.
Yeah, exactly.
I was not prepared.
Also, it says this can be interpreted as there's no cause for concern. So there's nothing to worry about. Oh, this isn't any big deal. You don't want to say those things because you don't know. And it depends. I mean, once you do know, then yes, tell them, whatever. But you really don't know. And that's why I always, if anybody's, ever ask me anything, I'll say, this is my experience, blah, blah, blah. Or you really need to go to a doctor and see what's going on with that. I'm not comfortable saying whether or not that's okay or not. You get lots of questions like that as a nurse that you can't answer. It's like, what does this mean? I don't diagnose people, or I can't look at your blood and decide what's wrong with you, I don't have x-ray vision. Anyway. Don't use questions beginning with why or how. A lot of times that makes people feel like you're kind of intruding on them, or they get defensive. If I say, well, why did you do that? How does that make you feel?
If you want to defend myself.
Yeah, it makes you want to say, well, I did blah, 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 whatever. And it's not going to go that way. Why didn't you take all of your medicine? But if I say, well, I noticed these pills were left in here. What happened with, did you forget them, or, don't give advice, right? Unless it is official, directions, like how you take your medicine. And there's a difference in me telling a patient how to take their medicine and me saying, oh, well, if it were me, I think I'd take some extra vitamin C. It's not, if it's, for me as a nurse at least, it's not ordered, I can't tell them to take anything. I'm not going to give any advice like that. It denies the patient the right to make their own decisions. You know, I've had situations, so for example, when I was having Hannah, and I labored all day, and I wasn't sure, you know, the doctor came in and said, you know, we can either wait a little while.
Teachers and students, pardon this interruption. At this time, I have a quick announcement, and then they need all juniors to report to the cafeteria. Those students, the seniors who are on the homecoming court, anyone on the court today can leave at lunch and must return back to the school by 1:45. All court participants are allowed to leave at lunch to go home to get ready and need to be back to the school by 1:45. Thank you.
2:15. Oh, and so anyway, so we got to the end of the day, and my doctor gave me two options. She was like, we can either do the C-section, or we can let you rest a little while and then keep laboring, and we'll try again. And you know, she didn't try to tell me, push me either direction. And I said, I just need, you know, what do you think is going to be the best option? So I asked her, okay, and she said, you know, there's no guarantee that you're able to have her without having a C-section. And so, nice. So that's, you know, one example of, she didn't tell me, she wanted to give me the option either way, because either way was a possibility, but she
And then it
really
was still your
thought that
decision.
the C-section was probably going to happen anyway, you know, so. So she let it still be my decision. Don't keep changing the subject. Sometimes you'll hear, you know, and this happens a lot when you're talking to a patient about their family, or you're asking them questions, but you really have another, like you really need to get an assessment done. Let them finish their thoughts before you go on, or find a stopping place to keep going on. It makes them think that you're ignoring them, that you don't hear what they have to say. And then 5, don't use judgmental comments. You are acting very grown up. How do you think, you know, says how do you think they would feel if they saw you act like this? You never know why people do the things they do. You don't know what goes on when you're not around them. And that same thing goes for other students. You don't know why they act the way that they do, or why they say the things that they do. You don't know what their home life is like. And so you just got to keep that in mind. Gender bias, last thing, in something that you, well, sometimes you need, but typically don't. Words used often reflect a gender role bias. Like, we tend to think of nurses as all females, but there's actually tons of male nurses out there. Gender roles have changed, and then just be careful that you know, not all doctors are he's and not all nurses are she's, because it can go both ways for sure. Anyways, that's verbal communication. We'll talk about nonverbal next week. Okay. I will talk about the case study and portfolio. Actually, let's go ahead and go, well, we'll just go to that next week. We'll just do both those.